So for our next commendation, we're missing Miss Jo Sanchez, who we really would like to be on here. Catherine, would you like to move ahead and go ahead and give your commendation? No, Jo's not on yet. Okay.
Yes, thank you. So on behalf of the Board of Education, we'd like to recognize and honor the healthcare workers of our district. As Dr. Cleveland mentioned, our healthcare team consists of the nurse coordinator, Jo Sanchez, resource nurses at all of our schools, care room aides, help assistants, and substitute and casual nurses. The National Association of School Nurses definition of school nursing, a specialized practice of nursing, protects and promotes student health, facilitates optimal development, and advances academic success. School nurses, grounded in ethical and evidence-based practice, are the leaders who bridge healthcare and education, provide care coordination, advocate for quality student-centered care, and collaborate to design systems that allow individuals and communities to develop their full potential. Our frontline healthcare workers have faced a lot of challenges this year and are unsung heroes. They serve our staff and students, and their dedication doesn't go unnoticed. We know that there is added stress and anxiety due to the pandemic. For some students, a school nurse may be the only provider that they see all year. Their team administers medication, first aid, performs screening for vision, hearing, height, and weight. They refer for medical, psychological, and social emotional needs. They oversee the immunizations, are in compliance. In addition, they educate teachers, students, and parents on health matters. They have countless responsibilities that are just too many to list. The team also added care room aides this year due to the pandemic. Their team has a tremendous amount of added responsibilities, especially when we have positive COVID cases and help with contact tracing. Jo Sanchez has spent countless hours during this school year to make sure our students' needs are met. Our healthcare team is truly appreciated for all that they do. And again, with this pandemic, there's just so much that have been added onto their responsibilities, and we can't thank you enough from our board. Thank you.
Thank you, Catherine, so much for giving that on behalf of our board tonight. And I think you said it perfectly well. I know Jo's trying to get on. I wish you were here. We see her all over. Oh, here, go ahead, Tana. Did you want to?
President Galbraith, members of the board, Dr. Cleveland, yes, she's trying to get on right now. So, yeah, definitely, Catherine, you said everything that is so important about our healthcare workers. And Kim Williams is the resource nurse for the district. So I do want to give a shout out for her name as well, because her and Jo have worked in tandem, incredible hours, and just really thoughtful, as well as all of our care room aides and nurses. And so I know Jo is trying to get on right now, but we couldn't have done it without them. So
yes, Dr. Cleveland was telling me about how much that Kim has done as well. So it's just amazing, and it's truly appreciated.
So thank you for doing this. I know they appreciate it, and they're just, all of our nurses are just so thoughtful, and our PLCs and nurses meetings and everything that's talked about, and it's always comes back to the students and the community.
And one thing I'd like to note is that our district, has had nurses at all the schools way before a lot of other school districts have. And I think that of all times that it was greatly needed, it was now. So it's really appreciated.
And that is something that, the board, you've always supported since I've been in the district, of having nurses at our school. And now we know, they're always important, but now we know why they're really important too. And so that is also something to be said for our community and how we value our nurses and our health assistants as well. So I'm not sure, but she said she was looking for the invite. So.
Well, I see Dr. Cleveland just came on camera. We'll let her kind of add some words. And
well, I said a lot, but I do want to say nursing services is counseling and many other student services are under Tana Burgos, and she has worked really hard to support them as well. And But I mean, really, it has been an incredible job this year. So I've already said it once, but just thank you so much. We truly couldn't have made it through this year without them. I really don't think we could have made it. And so we appreciate everyone who was part of that effort.
Thank you, Dr. Cleveland. And I know Catherine just presented this on behalf of the board, but I do want to just give the board an extra opportunity just to say thank you if you would like to. And so let's go ahead and do that. Jeffrey Morgan, would you like to start off?
Yeah, Catherine said it all. I just want to say thanks. Very important role. So really appreciate all the work that you guys have done and what you're still doing. So again, big thanks to all of you.
And then Wynn Coleman.
I feel like I sound like a broken record when I say that I'm just amazed as we've gone through this whole entire process of the selfless acts that the staff and administration have really put forth through this. And, you know, it's just so appreciative. And I'm so grateful for just the nursing staff and for all the health aspects that they really are in tune with our students and our families. So thank you so much.
And then Noreen Scott.
I too want to say thank you. And I also want to take note of the fact that even though our middle school and high school nurses were not in their schools, they stepped up and helped in the elementary schools. And we really are grateful for everybody's willingness to just dig in and help. So thank you.
Yeah. Okay, thank you. Thank you again, Catherine, for presenting that on behalf of our board, and thank you to all of our staff. And truly, I feel like every time we start to figure something out, it all changes on us. And I'm really excited for our kids to get back to school, but it's going to be a lot for all of our staff, but also definitely for our nurses as we go back into a full school schedule. Oh, here's Joe's on.
Yes, Joe just joined. So.
You're muted, Joe. We'll give you a second. You're still muted. We'll just wait for you. You're good.
Hit the space bar.
Try the space bar, Joe. See if that works.
I think she's on her phone.
Oh, she's on her phone. I told her to go through her phone.
I feel like it's been a night of like technical difficulties. We're just everything tonight. I'm trying to think of how to tell her how to unmute. I wonder if, Jane, is there any way that you can put something in where she can unmute real quick?
Try *6.
Try *6, Joe.
Yeah, unfortunately.
On your phone. Oh, did I lose you?
Oh, that didn't work. I can totally relate. This is the problem I was having.
Renee, we lost her. All right. That. Trying to think. Okay.
I think we lost her.
I think so too. That's okay.
Yeah,
oh no, she's still here. I see her. That's okay.
okay.
We are. Okay. Oh, there you are again, Joe. I don't know if we're going to be able to hear you, Joe.
Oh, here we go. Okay, now you
there
can
we
hear
go.
me.
Yeah. We all gave you our thank yous and everything. Do you want to say anything about your nursing staff? And
No, thank you all. You're so incredibly thoughtful. I'm so sorry. My audio was not working better. My computer is just not cooperating, but I really appreciate all of your kind words. And obviously I could never have accomplished a portion of what I have without the amazing nurses that I work with, and the health assistants and the care room aides too have just been incredible. So it's been a team effort, and obviously the people at the district office have just been amazingly supportive as well. So it's been fun to work with such a great team. I really appreciate it. So thank you.
thank you. And we truly do thank you. Catherine, did you want to say anything else before we go?
Of course, thank you, Joe. And then I do want to also say, Tana, that you know, I know you're a great leader for so many of these. You have so many added responsibilities, and I know that you know, the nurses fall under your department as well, and you've done a great job with everything that you guys have done to get our children back into the schools, and now it's going to be a bit different here in a couple of weeks now that they want to fully open. So we really appreciate it, and I know you guys are going to be really busy with all the students coming back. So thank you.
Thank you. Definitely a team effort.
Yes, yes. Thank you, Tana.
Thank
All
you.
right. Thank you. Thank you. Thank you, Joe, for getting on last minute. We appreciate it. We
Well, I'm
appreciate you
so
being
sorry it
here.
was so last minute because I just couldn't. My computer won't let me put my password in. It says it's the wrong password. So,
Well, we're glad you could get on and that you were able to unmute too. We're grateful.
thank you for your patience and thank you again for your recognition. It's very much appreciated.
Yeah. Thank you. We appreciate you.
All right.